Okay, and again, I want you to. Again, I'm going to give you a framework so you can handle anything comes your way. You think of the framework as muscles start out in life a plump, juicy hot dog. They slowly age into crispy bacon. Muscles, they start because these are your postural muscles. These tend to age, because they do a lot of the wear and tear. They do a lot of work. So a lot of times people have back pain because they do a lot of the work. And what happens over time, though, is these muscles, they turn into bacon. And so on some people, if you go any wider than the inside or outside line, they're going to go, what are you doing? It's not involved. But for other people, the pattern has spread. And what happens is this. Say we're in a crowded room. Pretend we're in a crowded room, and I'm a little tipsy. I'm going to hang on to Murat for support. And if Murat's tipsy, he's going to hang on to the person next to him for support. And this is what happens to those muscle fibers. They start clinging to the one next for support. And these patterns, they spread. So what starts generally here in the columns, it starts spreading wider. So this is how we approach things. So here's the inside line and outside line. For a lot of people, you won't have to go any wider than the inside and outside line. And if you do, they'll go, what are you doing? It's not involved. But for other people, the pattern has spread. And so for some people, you might come on this inside and outside line, they can't feel anything. It doesn't feel like it's having any effect or doing any good. Now, it might wake up with a few strokes, or it might be helpful to go wider. And as you go wider, you will find tissue that's alive, sensitive, and a stroke that feels like it's doing something. And then when you come back to the area that was numb, where it couldn't feel it, it'll be more receptive. And this is what I call working from the outside in, or from the living to the dead. So in this case, if this outside line didn't feel like it was having much effect, like it was doing anything, what am I going to do? I'm going to go wider. There's always a deck of cards next to the one you're working on. And in this case, what we're going to do is what I call the side of the rib cage. So if I have oil, or even without oil, all right, so then we're side of the rib cage. Wiggle skin right over the side of the rib cage. I'm going to angle up right on top of skin and bone. And what do I have? Deck of cards. Deck of cards. Now for some people, this might be ticklish. You can't even touch them. Don't even go there. Don't go any wider than the columns. For other people, this is numb, and going out here will be very beneficial. And as you come wider, there you go. This side of the rib cage will be alive and sensitive. And so you can angle right up on the ribs. The ribs, this is a place where more than one angle might work. You might be able to come straight across them. As you come up, you could even angle down. And you're always looking for those speed bumps. I got them too, right? And so what we do, we go wider. And then when you work, and you'll find, again, with very little pressure, you'll find tissue that's alive and sensitive. And then, once you've worked wider, then when you come back into here, it'll be more sensitive, more alive, more receptive to treatment. So this is, again, we give you a framework with this work to handle anything that comes your way, because there's no boxes. You know, for some people, you can work on here all day, and it's just not receptive. And if it's not receptive, we go wider, and then we come back. So, you know, here, you know, we solve problems. And we don't do it by analyzing posture. Forget what you feel. Because here's what I want you to know. Muscles can tweak anytime, any place. And especially the older we get, you know, the side that used to be the bad side, now the other side's tweaking. And so what I want you to understand is that muscles age from hot dog to bacon, and muscles can tweak anywhere, anytime. We're all walking around in various shades of gray between hot dog and bacon. We walk around with bacon patterns. Like for myself, I have bacon patterns over here that feel much worse on this side than this side. But sometimes this side is tweaking. If you went by what you felt, this side feels worse. But at that moment, this side didn't need it. It's holding stable. This side was tweaking and wants the work. So again, with AMR, we don't use postural analysis. You don't forget what you feel with your fingers. What we do is we scan patterns, we play them like a one-time deck of cards, and your client is going to tell you which fibers are involved in their pain on any given day. Because I know myself. A while back, I tweaked on this side, and right in there. That's it. That's the problem. That's what was fixing it. If you went by how it felt to my fingers, this side felt worse. But that side was holding stable, and it didn't really need treatment right there. It wanted 2 treatments right here fixed the problem. Now another time, I tweaked on this side. And it wants it over, the attention wants it over here. So again, forget what you think you feel, forget your postural analysis. We play the body like a one-time deck of cards, we scan the patterns, and their body's going to talk to them. And we play this game of involved or not involved. And very often, for someone, we think of the bigger picture. So if someone's pain anywhere, in the neck or blade, I'm always thinking of a pattern between here and here. Because so often, sometimes where they perceive the pain is only a part of the involved pattern. As we scan the bigger picture of it, they're going to feel how so much more was involved than they were ever aware of. So again, what we do is we scan patterns and we play a game of involved or not involved. This is interactive body work. And what I really do is I educate people to guide me. Because your body will talk to you. As it has, right? Doesn't it, right?
Yeah, actually the right side wants it.
See, the right side wants it. His body will talk to him and tell him where it wants it. I cannot tell by feeling.
Yeah, there you go.
Huh?
Better. Yeah.
Better?
You can go a little lower, actually. Like
Lower?
in the middle. Yeah, right there.
Thank you. See what I mean? I cannot tell by feeling. I will be thrown off. We have to get rid of this whole notion that we know better than the client what's involved or not involved in their situation. So again, really, it comes down to the fact that we all live with underlying spasm patterns all over our body. You know, you can have stable bacon patterns, but they're holding stable. And you can have areas that feel fleshier to your fingers and healthier, but that's what's symptomatic today. So you can't tell by feeling what's involved or what's not. And as we come down, up and down the inside and outside line, only he knows exactly which part wants more attention than others. Talk to me.
That's all good, right?
All good?
That's good, yeah. The midline. I mean the midline wants it the most.
Midline?
Yeah. Oh yeah, right there.
Okay, that's another line. The midline, the midline bony bumps of your spine. That is another line, and in this case, we're gonna go right over what you think is skin and bone. You can go one way, you can go the other. On this one, if one way feels better, just ask your patient.
That feels good. Yeah,
feels
right
good?
There, that right there, yeah. A little lower. Yeah, right there.
Right over the midline?
Yeah, right there.
There you go. So we have 3 lines right here. We have the midline, we have the inside line, and the outside line. So, and again, so we scan these lines, and as we go up and down, it's going to talk to him where, this right here?
Yeah, it wants it right there. Right where you were. So a little higher, Right there, yeah, that, yeah, that, oh, yeah.
See, and only he knows that.
Yeah. Oh.
Only he knows that.
It's already feeling better.
Already feeling better?
Yeah.
Yeah.
Oh, yeah.
There you go. It's so simple. So tapped into the deeper truth of back and body pain. Feels deep, right?
Feels so deep.
It feels deep, but
there's
a big...
lot of sensation. It's just a lot, and you feel a lot. It's just...
Yeah.
It feels like a really, really deep stretch, you know?
Yeah. And again, it's just...
It's not really pressure, it's just...
And what do you... Isn't this just barbaric in comparison now?
Yeah, it just feels like you're getting beat up.